Hey there, welcome to another episode of The Lamp. I'm Kokomo Lantern publisher Pat Muncie, and with me today is Kristina Sommers, a specialist from the Howard County Health Department that's here to talk about crisis preparedness and a series of seminars that they're putting on in the community throughout the year. So Kristina, thank you so much for joining us today. Let's let people know a little bit about the program and how it came about.
Well, so the initiative is called Crisis Ready Howard County, and it is a year-long program where we'll talk about a different topic each month. How it came about was about in 2017, I read FEMA's National Disaster Household Preparedness Survey and realized that true community preparedness does not start with first responders, which is who people usually think about.
Sure.
But it actually starts with you, the audience, at the grassroots level with households and individuals. Because if people aren't prepared for disasters, then our community isn't truly prepared.
And we're not talking about like huge tornadoes and floods. I mean, we are talking about that, but we're also talking about smaller things, just like power outages and snowstorms that have you laid up for a few days or things like that. So, or stranded on the side of the road in a car, right? So these are the kind of things that you talk about in these sessions, right? So what has the reception been like so far to your programming?
Well, so far, the community has responded fairly well. We had about 52 people in January. In January, we kicked off the series with why you should prepare, being able to recognize scenarios that you're preparing for, and a 4-step process of being able to create a plan. And then in February, we talked about food and water supplies, very practical tips about what kind of food works best, how to safely store water, because a lot of people might try to put it in a milk jug.
Oh,
you can't really reuse milk jugs. So just very practical tips, how much you should have stored back. And about 53 people came that month. I think we're going to top that this month because last week at our Kokomo event, we had 26 people come, which more than doubled what we had back in February when we only had 11. And this month we're talking about the rest of your emergency kit and what supplies to put it in, and also how to create a go bag and where you should store those go bags.
A go bag. So let's talk about go bag. I mean, because there's going to be people that won't be able to make your session. So what is a go bag and why do I need one?
Well, a go bag is built specifically for evacuations. So you want to take whatever you would have in a general preparedness kit and strip it down to the essentials. You want some clothes in there, maybe some snacks, but I wouldn't take like heavy canned foods or anything like that. Maybe a first aid kit. And any essential documents, maybe on a USB drive, already have them pre-scanned. But anything you might need for like the next 1 to 3 days to get you through to like you can get to a hotel and make sure you're okay if you have to evacuate your house and then you come back and your house is gone. It's just very bare essentials because you want to be able to carry it.
Gotcha. Oh, so it needs to be like in a backpack or smaller then. All right. And then that's just for go bag. But when I'm talking about a situation where I'm going to be stuck in my house for a few days, I'm obviously not going anywhere, so how do I prepare in that situation then?
So for that sort of thing, you want to have enough food and water for at least 3 days in case you get stuck and maybe the water gets turned off or something like that, or you live out in the country and you lose power so you don't have access to your well water anymore. You want to make sure you have enough medications to get through, as well as if you do lose electricity, manual can openers, maybe a generator if you have access to be able to do that. Just think through what would I need at my house normally, and then make sure you have a couple of spares just in case things go wrong and you can't get out and go shopping.
I don't have to get elaborate with this either. I don't have to duplicate everything in my kitchen, for example. So really, I'm just talking about when you're talking about foods that I need for 1 to 3 days. I mean, not like prepared meals frozen or anything like that. You're talking about like tuna in a bag. So the stuff that you can see, that you can buy at the store that's like a quick lunch type of thing that I don't need to heat up. All right, so that's the kind of things you discuss.
Unless you have backup cooking methods, such as using your grill.
Oh, well, there's that too. So talk about all
things we talked about in February was, backup cooking methods, choosing low sodium foods so you don't need to drink as much water if you do have water restriction, choosing foods high in protein and fiber so they keep you full longer.
Okay. Well, you said we can't use milk jugs for storing water. So what's the appropriate way to store water then?
So you can either buy it from the store, which is the easiest, and then it's good for about a year. And then if you want to get it from your tap, you can. If you live in the city, you would want to store it in such as an old pop bottle or juice bottle or old water bottle, that sort of thing. And then you just cap it up and date it and replace it every 6 months. And then if you live in the country, you do the same thing, other than you're going to want to add 6 drops of bleach for every gallon of water. Let it sit open for 30 minutes. Then you can put the cap on and label it and replace it in 6 months.
So the 6 drops of bleach is not going to hurt me?
No.
Interesting.
Yeah.
All right. So why can't I use that milk jug?
Because you can never clean the milk colloids out of that plastic well enough, and it will spoil the water.
Oh my gosh. Okay, I did not know that.
Yeah,
but,
you don't want to do that.
But then I've never done anything that would be considered prepper, I guess. And maybe that's not the right term, because when I hear the term prepper, and maybe other people do, they think of the stuff you see in Hollywood where they're fringe people out there and they don't comb their hair, and which is not my problem, obviously. You know, and maybe they only have one set of clothes and it's fatigues that they got at an RV surplus store, that kind of thing.
Yeah.
That's what people might think of as preppers, but that's not what we're talking about here at all.
No.
So how do we remove that stigma from this whole idea of being prepared?
Well, we're just talking about basic, not really everyday preparedness, but very basic preparedness skills. Like next month, we're going to talk about evacuation and how to shelter in place. So how can you safely shelter in place, whether no matter where you are, whether you're inside or outside, what steps do you need to take? If you need to evacuate, where do you evacuate to? How should you be prepared to evacuate? And then in May, we're going to kind of switch gears and we're going to talk about weather preparedness, and hot weather is going to be coming. So how do you prepare for hot weather? What sort of medical symptoms do you need to look for, like in case you're facing heat exhaustion or heat cramps? And so every month we're going to tackle a different topic. And what's really cool is each of those topics is actually paired with a first aid skill.
Okay.
Yeah, because we found it's not just me that put this together. We have a whole planning team from the community that helped put this program together. It was about 9 months of planning and development to get the presentations and to get all the materials and what we were going to talk about. And the planning team was very passionate of, we want to get first aid skills out to the community. And that actually worked really well with Health First Indiana initiative, which helped fund some of the incentives we're giving.
Okay.
Which I could talk about the incentives in a
Yeah, I didn't know there were incentives. Holy cow, we're going to get prizes, guys.
Yeah, but let's finish about the first aid.
Sure. Hold on.
So we have 4 first aid courses that we're offering 3 times throughout the year. They're kind of on a rotation. So in January, we offered Stop the Bleed. EMS services at St. Vincent helped put that on. And throughout the rest of the year, at least Greentown Volunteer Fire Department is going to help out in the Greentown sessions for those. And then in February, we did Hands Only CPR by the American Red Cross. This month was QPR, which is suicide prevention training, offered by 4C Health. And then next month, we're going to be doing Narcan administration training, which is done by the Howard County Health Department.
Wow, so there's going to be something new at each one of these sessions, and it's going to go all the way through the year. Yep. Is there a cost involved to attend?
To attend Crisis Ready, there is not. Now, some of the first aid courses, only one of them has a cost, and that's when we offer certified CPR in May. And the costs will vary on location because we do have 2 different CPR providers. And we're actually going to do a Public Health Minute video about that. So if you're not aware of Public Health Minute, you can watch our video on Facebook, Instagram, or YouTube and catch out, learn a little bit more about what that course is going to look like.
Sure. Now, you say that you got stuff all over the community. So you're doing Rocheville, you're doing Kokomo, and you're doing Greentown.
Yes.
Is it the same program done 3 times, one for each group? So if you live in Greentown and you miss that one, you can catch one of the other 2. It's the same program, so you won't miss out there.
Yep. The only thing that's a little different is the first aid courses aren't always offered at Greentown and Rocheville, so you do have to pay attention to that.
Okay. All right. Very cool. So no cost involved.
Nope.
Do I need to RSVP or register for these things?
It's very helpful. Just so that way I know how much to prepare and bring, and especially for the first aid courses, like if we're needing to prepare materials to bring with us. The QPR class for this month actually got canceled because we only had 2 people show up and we needed 5, and I wasn't aware of that, and that's okay. So sometimes, but that's the only one where it really matters, that if you register, you attend. But yeah, it's just so that way I know to bring enough incentives.
Gotcha. So how do I register for these events?
So on every flyer that we have, there's a QR code, and you can scan the QR code, and also on our social media, and where I have the events advertised on the Visitors Bureau and through the Kokomo Lantern posts, weekly posts, there's a link that you can click and register there.
Very cool. So now let's talk about that swag.
Yeah.
So we get all kinds of goodies at these things. What are we getting? What do we got lined up?
Well, pretty much what the planning team picked out is things that can help stock somebody's kit. Because we realize for some people, there's financial constraints. The cost of everything's going higher and we're not necessarily getting paid more. So we wanted to make it easy for people to prepare no matter what their socioeconomic status. or even like just ability to remember, hey, I'm at the store. Maybe I should buy this thing I don't normally buy because that's normally my problem. I'm not buying something out of the, like whenever I'm trying to buy something out of the ordinary, I always forget whether it's on my list or not.
Right.
So in January, we did manual can openers.
Okay.
And American Red Cross supplied first aid kits, so we passed those out.
All right.
Last month in February, we gave out collapsible gallon water jugs. So that way, you know, when you're not in use, you just collapse them. Water purification tablets.
Huh.
And there was some other stuff. And then this month, we're also passing out, sorry, I got to think through.
It's all right.
Because there's a lot of different things that we're doing. We're passing out drawstring bags that have the Crisis Ready logo on them. N95 masks, courtesy of the health department, because we had some expired ones, but they'll still work for these sorts of things.
Gotcha.
Yeah, and body wipes. You get a pack of 10 body wipes, because if you have low water, you still want to maintain hygienic practices.
Well, let's take one step back there. You mentioned the 95 masks. Most of the people that are watching this most likely still have a package of masks they got back in 2020.
Yep.
And you said expire. So can I use these masks, or do I need to throw these out?
Usually the expiration is because the elastic might break, and that's more for healthcare practices. So they would still work, but because most of the general public, they haven't been fit tested for those masks like a healthcare provider anyway. But when you're talking about a crisis kit, we're mostly using that sort of mask for a dust filter. Because if there's a tornado or even a fire or an earthquake, there can be a lot of particulates like dust and other things in the air that you don't want to breathe in. So you're putting that mask on to help filter that air out of the big things.
Gotcha. And I'm sure we all have a lot of antibacterial alcohol-based hand wash. Does that stuff expire, or is it still good too?
I keep hearing that it doesn't really expire. It's just they have to put expiration dates on it. But
Gotcha.
I am also not a medical professional, so.
Gotcha. So if I threw that into my go bag or my prep kit, it's okay. It's
yes.
okay.
But
So
we do recommend that you check your go bag every 6 months just to make sure, because if you have food in there, medication, you want to make sure you're rotating those things out. And I would rather rotate it out before it expires, so that way I'm not wasting it, because I'm really, I don't like wasting things. So that way you can put it back in rotation with your regular things before it expires.
Gotcha. All right. So I think we're probably, by the time this airs, too late for your next event, which I think when we're filming is like a day from now, right? But what would be the next date that people could attend one of your Crisis Ready presentations?
Well, let's see. It depends when it airs, because we do have 3 events in April.
Well, this will air before we get to that, I'm guessing.
Okay.
So, yeah.
So we'll have, it's always the first Thursday of April is when we're in Greentown. And then, sorry, I don't have my dates memorized.
That's all right.
In Rusheville, we'll be there April 16th. And in Kokomo, we will be there April 10th.
Gotcha. And this topic again in April is?
Evacuation and shelter in place.
All right. So if you've got any concerns about if we had a fire or a chemical spill and it's airborne and we need to get you out, these are the kind of things that we're tackling in this. And what's the free piece of swag that we're getting in this one?
Oh, what are we're passing out? I believe duct tape and whistles.
Duct tape and whistles.
And there might be something else. That's just what I remember off the top of my head. And if we have leftover items, like I still have can openers, so I keep bringing them in case you missed the past one. So you can always ask me for an incentive we passed out before. And we also share the presentations. So if anybody wants a copy of the presentation, we send that out as a PDF.
Oh, very good. And hey, you know what? Duct tape, I think, is probably all I would need in a prep kit. That does just about everything other than feed me. So that's, if you're giving out free duct tape, that's pretty cool. All right. Is there anything else that people need to know about this program or where they can contact you for more information?
Well, if you want to, you can contact me at any time. You can leave me a voicemail, because I do work part-time, so I'm not always at the office. My phone number is 456-2405. That is my direct line. And then I would spell out my email address, but that's a bit long, but it is on our county website. Like if you go to the health department's webpage, I believe it's on that webpage.
Okay, well, if we can find that, we'll try to put it down along the bottom of the screen here, and that help you out. So there you go. So if you're interested, it's coming up here in April. Sounds like a pretty good time. A lot of good educational information there that you need if you're at all worried about what you'll need to do in case of an evacuation or a shelter in place, or really any kind of disaster preparedness. this is what you've been looking for and you didn't even know it. So I want to thank the Howard County Health Department and Kristina for offering the program, for spending the time with us today. I encourage you all to get involved with this program. I think there's useful information in there for literally anybody who's breathing. So again, thank you so much. Thank you for tuning in and watching. We'll have another episode here real soon, but in the meantime, please be good to each other.